What I wanted to do with this presentation was just take you around some of the features of the Liftupp interface. When you switch your iPad on, you should find the Liftupp icon, which looks like this as shown here. Touching the icon will open the app, and the first thing that you should see is a list of the available clinics and staff on that morning. But before we go into any more detail, I just want to take you around a couple of the icons that you see on the front page of the app. The first thing that you will see is up here, which is the sync button and the time when it was last synced. Now ideally, the iPad, when the app is first launched, the information will sync with the server. The iPad only knows what to do by getting information from the server, so if the iPad has been offline for a long time, you may find that this sync time is way out of step with the time and date of the clinic that is now. If that should be the case, it's a good idea to try and force a sync by touching this icon here as shown. If you do that, you will get this box that comes up that says force sync. If you touch that, it will try and sync with the server and come back to where you are. So that's good starting protocol for any time that you pick the iPad up. Just check that information there. The other icons up here are this cog, and what this cog is for is it gives you version information about the particular app that you're using and settings. 99% of the time that will be of no interest to you. This icon here, sort of compass, this allows you from the iPad to drop over to the web interface, so that if you're on the clinic and you want to look up some information about a student, then you can from the web interface. So, ideally, you should find yourself on the list. What happens if you're not on the list, or for example, that I'm on the list here, but I'm off sick and you've been asked to cover for a member of staff? To do that, you use I'm not on the list, I am covering for someone. You touch that, you touch who you're going to cover for, so you will be covering for me, and then you decide who you are, touch that, and then those students, whoever they are, will be reassigned to you and you will appear in the menu. So covering for someone is very, very straightforward. Incidentally, if any stage you want to get rid of a menu such as this, just touch somewhere else on the screen and the menu will disappear. So let's now go into a clinic. So this morning I'm going to be Mr. Kennedy. I'm on the restorative clinic. The restorative clinic is running from 9 o'clock till 11 o'clock. This icon here, incidentally, if you touch that, it will just tell you which students you have on with you. Now, because this is the demo version of the app, we haven't actually allocated any students in the timetable today, but we'll sort that out in a second. So now let's enter the clinic for Mr. Kennedy by touching that, and it will ask us for our unique passcode, which we would have previously set in the Liftupp web interface. But we will put the passcode in, which for the purposes of this demo app is just simply 4 A's. Hit OK, and now we will enter into the Liftupp interface where we deal with students. Now there are a few icons on this screen. The first is the eye down here. What that does is it gives me details of the clinic. Again, touching anywhere off the screen will make it disappear. And here is the compass icon again, which allows us at any point on the clinic to go over to the Liftupp web interface, maybe to look up some information about that student on previous performance, or maybe looking at some timetable information. Now, on a normal clinic that's been timetabled, the students that have been timetabled for you will appear in this box here. but we don't have any timetable today. That could be deliberate, or it could just be that someone's forgotten to do it. Either way, we can add students through this icon here, this plus icon. We touch the plusing icon, the available students in your school will appear. Now obviously for the purposes of this demo app, we've only put a few. So let's say today we're going to teach Adam Plumley and we're going to teach Keith Kennedy. By touching their names, you can see that they have been added over here, and when I'm finished, I just press done. You can see that there would be an image in the ideal world. In your schools, these images of these students will appear. The number refers to the year of study, and this plus icon refers that I have added them as an additional student. Now, if the students are timetabled, that plus icon will not appear. And you can also see, because I have added the students, that they have defaulted to being present. If the students were just added as part of being timetabled, then the default position for this would be that they were absent. Now, in this absent situation, you can see that a different thing appears. When they're present, we see show forms. When they're absent, we see add alert. Now, this alert is for the purposes of a clinic where patients have been pre-timetabled in, and you have a situation where maybe the patient has turned up, but the student is nowhere to be seen. And it is to trigger that process. By touching add alert, then what you get is a text box and a keyboard and instructions about what a clinical alert is about. But in this circumstance, it's quite simply the situation, as I've said, where the patient has turned up and the member of staff hasn't. You would type within the box patient present, but Mr. etc. And then what you would do is you would hit save. This information here tells you that this has been registered, and what will happen with the system is it will email a member of staff and let them know that this has been issued so that they can do something about it. Then you just hit OK. What happens if you added a student in error? Let's say actually Mr. Kennedy shouldn't have been on the clinic and everything we've done was incorrect. Then we could delete him, and you do that by just swiping left with your finger over the icon, and you get remove. You touch remove, and that student has now been removed from the system. We will just add another student back. Let's put Matt Cripps in. There we go, just for the purposes of the demo. Now, we're on the clinic and Mr. Plumley is present. So now what we would do is hit show forms. And you can see several things have happened. The first thing that's happened is that the student we are currently on, Mr. Plumley, has been highlighted. So we can see that all the information over here refers to that individual. And you can see that the clinic has been highlighted as restorative, and the Liftupp has now generated some forms for the purposes of collecting information about that student during this clinical episode. The forms that get generated are stored within the database. They happen automatically and are specific for each clinic that your school has decided the information that you need. In this particular clinic, we have a treatment form, a diagnosis form, but at the present there's no form for specific restorative activity that's specific to a patient. We'll talk about that in a minute. Also down here we have this icon that says additional forms. Now additional forms are there because, for example, this is a restorative treatment clinic, hence you've got the treatment form, but maybe there's going to be a situation on this clinic that you actually needed to do a treatment plan and a history, in which case you would just simply touch this form and it would be added up here, like this. If you do that accidentally, it does not matter. If there's no information in the form, then nothing will be pushed to the server. And these numbers here refer to the amount of information held within each of these forms, which is currently 0. So let's just have a quick look at the CDF history form. You do that by touching it, and then the form loads. First thing you'll see is that some of these items are bolded and some of these items are not bolded. For this test application, it's just been done at random, but the bolded items are there to give you a hint at what your clinic would be most suited for, and the unbolded items are there for you to use, but may indicate that these things are not going to happen too often on this particular clinic. The other thing that's appeared down here are the descriptors. If you touch the descriptors, then it comes up with the Liftupp 6-point scale or developmental indicators, levels of feedback, etc. So they are always available for you for reference while I'm on the clinic. And again, if you just touch at the bottom, these will disappear. The eyes information icon here is telling you, if you were to touch that, what that particular observation is about, i.e. how it's been mapped. And as I demonstrated in the video for the staff interface, it is worth, before you're coming down on the clinic, having a reasonable idea what it is that you're actually making judgments on. But should you not be sure, you can touch that icon on each of these things and it will tell you. And you just have to hit done for that to disappear. Making a judgment of developmental indicator is a simple matter of simply touching the relevant number. So if you feel that the student's needing a bit of verbal guidance for this particular thing, then you would hit 4. When you do that, you will notice that this lights up and you get this little comment icon. The comment icon is there for you to give some written feedback should you wish. By touching the comment icon, you get the familiar text box, you can type your written feedback, hit save, and then that will go into the database. So let's do that. And when you have made that comment, it will appear underneath. If, for example, in the medical history, you give a 6 and you suddenly decide, oh, I didn't mean to touch the medical history because I didn't actually hear that bit, you can remove the developmental indicator by pressing the cross. To change your mind on something is just a matter of touching the other button. So for example, in extra oral examination, you accidentally touched the 5, but what you meant was a 3, then you touch that. Now you'll see that when the 3 is touched, because in our school that is the threshold that's been set up for giving feedback, this time the feedback box has automatically appeared. So above threshold you have the choice whether to give written feedback. Below a threshold you're required to give written feedback, and your individual school will set that up for you. So that is the basic form operation, and also of course you can scroll down. Those of you with smaller fingers may prefer to orientate the iPad in the portrait mode by just flipping it over. Those of you with sausage fingers like myself will probably be happier working in landscape mode, as shown. To go back to the form homepage, you just touch Forms up here, and that will take you back. And you can see now that in the CDF history form, we have added 2 developmental indicators, which is what that 2 means. What about adding a new patient? Well, to add a new patient, you simply touch New Patient, and depending on how your school NHS patient identifiers work will depend what you now have to add and how you do it. But at Liverpool we have a 8-digit code for our patients, so we will put in that patient number. Once that number is in, you'll be asked to confirm that you've got the right patient. So if you hit confirm, you can now make a decision of whether the patient actually you've added them to make information over failed to attend or unable to attend. But the other thing that is required, it hasn't seen this patient before, so at Liverpool at least, it needs some information about the demographic. So first of all, you touch date of birth, and then you can select the patient's date of birth from this roller wheel down here. Hit save, date of birth goes in, you would then select gender, and then at the bottom down here you can select their ethnicity from the NHS standards. When you are happy with that, you would hit done. Before I leave this screen though, you can also see there's a button here that says simulated, and this is for situations where maybe the patient doesn't turn up and you want to give the student a simulated task, such as a mobile phantom head on the clinic. The patient will go into the database as a simulated patient. So let's hit done, and you can now see that this patient has been added. They're a male at 27 years old, and you can see now that because we're on the restorative clinic, this very specific restorative clinic form for that patient has been generated. So let's have a little look at that restorative clinic form. Now, a little word about some form terminology. You can see up here that there is a header, and underneath that header are a series of questions. In this situation, the question section is open. If we scroll down on the iPad, you'll see that some of the sections are actually closed, such as periodontics prevention, direct restorations, etc. Your school will set up what they want by default as open and what they want by default as closed. As a rule, the ones that staff miss more often tend to be the ones that are open. So people often forget to look at the basic operative skills, such as patient and operator positions, light positions. Hence, that is open, so it's kind of in their face, so that they will make judgments on that. Let's, for the sake of ease, look at something very familiar. Let's look at direct restorations. So maybe you're in a situation where this patient has arrived and you're going to do a direct restoration, or rather the student's going to do a direct restoration, in this case Mr. Plumley, and you want to add that direct restoration to the system. So what you do is you hit show, and depending on the section, what happens next will be specific to that section. But direct restorations is a good example. So you'd be required to select a quadrant. So let's select the lower right quadrant, and let's say that Adam's going to be doing the lower right 6. We've decided that this tooth, for all intents and purposes, should be quite a basic operation, both in terms of the cavity and the preparation and the patient management. And then down here we need to select the surface, which is going to be an approximal posterior, and then the material, amalgam. And then that is set up. We hit done, and you can see that this section has now been customized for the direct restoration of the lower right 6, which is basic, approximal posterior, amalgam. And then we have the ability to make our observations. And our observations are about moisture control, caries management, management of the pulp. So let's say what we'd seen on this occasion was that the moisture control was independently done to the correct level. The caries, well, that wasn't quite perfect and required a little bit of verbal guidance. Although we've not been forced to give any feedback, we might decide for the student's sake to give some feedback. like that. Appropriate management of the pulp, we may feel that was independently done, and then maybe we didn't see anything else because we were with other students until the appropriate restoration of tooth contour anatomy, and we were really quite impressed with that. Now, appropriate restoration of tooth contour anatomy is one of those areas that I've talked about on the Liftupp interface demonstration in the form section. That is where the system does its count, so it's one of those that you must fill in. And then the other areas we felt the procedural knowledge was okay too. What about if Adam had then gone on to do an additional procedure in that patient, another filling? Then all we do is we go up here and we hit add item, I add another, and you can see that another instance of direct restorations has now been generated. We hit show, and now he was doing the lower right 3, that was basic, and he was doing a class 3 composite, say, and then we can hit done. And we felt the moisture control again was good, and actually all we managed to see on that one, because the clinic got really hectic, was the appropriate restoration of tooth contour and anatomy, which we felt should have been a 4. But we decided we weren't going to leave any additional feedback on this occasion. However, we also noted that there was a tiny little nick on the 2, where they'd been a little bit careless with the handpiece, so we would say there was some iatrogenic damage, and we might make a little comment about that. Okay, if we then want to go back to our other forms and we want to add something into the treatment form, it's very, very easy to do, and we might make some thought process about, well, the local anaesthesia was fine, we felt the infection control was fine, we'd seen Adam communicate with the family and we felt that was fine. I was very happy how they communicated with me. When I looked at the notes, that was fine. I felt he'd been very professional, and I felt the time management was quite reasonable. At the end of the clinic, what you may expect to happen is to sit down with a student, and that's when I tend to make my judgments about insight. So I'd sit down at the end of the clinic and I'd say to Adam, how do you think things went? And I would expect him, with having some insight, to be able to look at the information that I've given feedback on and tell me that he thought things had gone quite well, that he'd missed a little bit of caries, that there was that minor abrasion, he told me how to deal with that, and I would have felt, if that was the case, his insight was pretty good. At that stage, I would be signing Adam out of the clinic, and to do that, I would be using this summary button up here. Incidentally, the clinical alert here is exactly the same concept as the add alert at the start. So let's say that Adam, something had happened untoward, that he had really damaged that tooth and I needed to write a report. I could touch the clinical alert and write my report. But fortunately, he hasn't done that. So we're at the end of the clinic, and what we're going to do is we're going to give Adam some feedback. So we hit summary, and what it does is it brings together all the information that I have given feedback on into one place, and it color codes it. And those color codes are related to the threshold. So if you're working below the threshold, you'll get a red highlight. If you're working independently, you get a green highlight, and if you're working with some assistance, then you're in the white area. So Adam is able to scroll down and see the feedback that he has been given. And what I will do is go through this with the student very quickly. So the sort of thing that I would be saying with this is, Adam, I felt today there were many, many good things. You can see all the areas of independence here. We don't need to spend any great time on that. However, I think you need to give some more structure when you're establishing history. You're kind of all over the place. Try and practice getting some order to it. And you're aware that when you left the caries, you left a little bit because you hadn't looked at that axiopopal wall. And with relation to the procedure itself, there was appropriate restoration of tooth contour anatomy, and I felt that other things were quite good. I've suddenly noticed that my iatrogenic damage, I've said absence yes, but actually it should have been absence no, because iatrogenic damage was present. So to fix that, I can hit the cancel button. I can go back to the iatrogenic damage, which is on the restorative form. So I could either use the button up here, Forms, or I could use the buttons at the bottom to go to the restorative form. I could scroll down and I could change that to no, as so. And then I could go back, hit Summary, it will redo it, and you can see now that the iatrogenic damage has turned to no, there was some, and that has now gone red along with my comment. So it's never too late to make a change. Once Adam has had a chance to assimilate that, which shouldn't take more than 20-30 seconds, he will hit confirm and he will put in his unique password. You won't know what it is, that's the whole point, it's a student digital signature. He will put his in, hit OK, and now his record is locked. There is nothing more that I can do with that, and if there's any more information to go in, it's now too late. What about Matt? Well, again, for Matt, you would just do the same thing. You would give Matt some information, and then you would swap and give him some feedback. And swapping between students on the clinic is just as easy as just touching their icon as you move around. Key thing is with the iPad app that you must use it synchronously, i.e. don't try and do it all at the end, that just wouldn't work. Try and do it as you go along. At the end of the session, a member of staff also needs to sign out, and there are a number of scenarios that could occur. So let's say we have the scenario here where Matt, a student, has been present and they haven't themselves signed out. If you hit sign out, it will tell you that Matt Cripps has not signed out. You have two choices. You have cannot complete the clinic. So if the situation occurred where Matt had actually gone and he couldn't sign out, you can hit the cannot complete the clinic, and it will ask you to write a reason why you can't complete the clinic, i.e. all the students haven't signed out. It could be that the student's gone, it could be that you need to leave the clinic early for some reason. What about the situation actually, so let's have the situation where Matt was never present because he didn't turn up, and let's try and sign out then. Now you have the option of completing the clinic. If you touch that, it will ask you to sign out with your unique PIN, and then everything will work. The eagle-eyed amongst you would have also seen in both those previous scenarios there was another option, and that was previous staff left. That's the same on both those previous scenarios. That occurs for the member of staff that's forgotten to sign out, because the issue you have is you don't know what their PIN is, so the iPad is essentially now useless if you came to the clinic and you found it lying there like this. So if you do find that happens, if you press previous staff left, you can select yourself from the list and you will be able to then sign out using your PIN. But crucially, in the database, it will record that that member of staff has left and you've had to sign out for them. So if there's a member of staff that's continually doing that, eventually whoever is their line manager will be alerted to the fact that they're not doing this in an appropriate manner. So let's just sign out now, complete the clinic. I will put the PIN in, hit OK, and the iPad will now sync. It will push the data to the database, and this is probably the time to put the iPad away. You can leave it on this screen, and then when the member of staff next picks it up, you can hit Return to Clinic, and it will take you back to the relevant front screen for that day. Please remember to plug the iPads in. Everything with the iPad is not breakable. Please have a play with it. You can reverse decisions as I've shown you. When you're learning how to use it, just press things and see what they do. But always remember the ethos of what you're doing with the iPad, which is developing the student, its observation and feedback. Thank you very much.